Now, let's talk about some of the common reasons mothers are considered high risk, and what are some that we see usually?
So you can have a pre-existing medical problem, which would make your pregnancy high risk. And then there's other complications, which we're going to be talking about today, where you're pregnant, you have no medical problems, and then complications do occur during your pregnancy.
So why does that happen? Why does a pregnancy start off normal and then complications happen?
So there are some predisposing risk factors, and we'll talk about the different complications that can happen.
Right.
But if you're overweight, for example, you're at higher risk for having certain complications. Age is always a risk factor. Family history of certain medical problems, family history of diabetes, of high blood pressure, all sorts of these types of medical history can make your pregnancy higher risk as that occurs. So that's why lifestyle and
Right.
exercise and all of these sorts of things are so important.
Now, what are some of the most common complications you look out for throughout the pregnancy? Anything that you have to keep an eye for?
Right, so prenatal care. We always stress how important that is to come for your appointments. And that's why we do that, because we are always monitoring for all sorts of complications
Right.
that can happen in pregnancy. So most pregnant women, when you go, you know you're always having your blood pressure checked.
Right.
That's something very basic, and we're going to be talking about this later on. So that's to monitor for preeclampsia. So here we go. We have a nice little slide here. So high blood pressure. And then the third one there, preeclampsia, they kind of go together, but that's why you get your blood pressure
Right.
checked every single visit.
And I like to stress that sometimes when you're, not sometimes, when you're pregnant, you have to go to these routine doctor visits and you think, well, why do I have to go get my blood pressure again? Why are we listening to the heartbeat again? But we need these vital signs.
Exactly, absolutely. And you get your weight checked. A healthy lifestyle. If you gain too much weight in your
Right.
pregnancy, that's going to be a risk factor for complications that develop in pregnancy.